This is Dr. Ross, and this presentation is on the appendicular muscles of the leg, and it's for my class as well as Dr. Camp's anatomy and physiology class at Lee College. So the appendicular muscles of the lower body are there to position and stabilize the pelvic girdle, and that of course serves as a foundation for the lower limbs. There's a lot less movement in the pelvic girdle compared to the pectoral girdle. And that is because of its connection with the sacrum at the base of the axial skeleton. The pelvic girdle has less range of motion because it's there for stabilization and support of the body. But what the leg muscles lack in range of motion and versatility, they more than make up for in size and power, so they can facilitate stabilization of the body as well as posture and movement. So let's first start with muscles that move the femur. So the large and powerful muscles of the hip that move the femur generally originate on the pelvic girdle and they insert into the femur. Some of the largest and most powerful muscles in the body are the gluteal muscles, and this is going to include the gluteus maximus, which is the largest, and it's deep to the gluteus maximus where you'll find the gluteus medius, and then deep to that you will find the gluteus minimus. And so that's going to be the smallest of the trio. The gluteus maximus, shown here, extends the thigh. It laterally rotates the thigh. The origin is on the iliac crest, the sacrum, and the coccyx. The insertion is the iliotibial tract, IT tract of the fascia latae, as well as the gluteal tuberosity of the femur. Here you can see a little bit of the gluteus medius. This abducts the thigh as well as medial rotation of the thigh. The origin here is going to be on the posterior iliac crest, and the insertion is going to be on the greater trochanter of the femur. Now the gluteus minimus you can really only see by pulling away the medius and the maximus muscles. This one also abducts the thigh and medially rotates the thigh. The origin is the surface of the ilium between the inferior and anterior gluteal lines. It inserts at the greater trochanter of the femur like the gluteus medius. Next is the sartorius. This is a small band here. It flexes the thigh and laterally rotates the thigh. It also flexes the leg and medially rotates the leg through that motion. The origin is the anterior iliac spine, the anterior superior iliac spine, and the insertion is the tibial tuberosity on the medial side. You also have the tensor fascia latae that abducts the thigh medially. It abducts the thigh and medially rotates the thigh. It also helps maintain posture by stabilizing the IT band. The origin is the iliac crest and the lateral surface of the iliac spine, and the insertion is the iliotibial band or the IT band. Last is the IT band or tract. This is basically a long fibrous reinforcement of that the fascia latae muscle. The action of the muscles that are associated with this band are going to help flex, extend, abduct, and laterally and medially rotate the hip. And you can see there are several muscles that are associated there. So moving on to other leg muscles, we have the iliopsoas. In some books, this is separated as the iliacus plus the psoas major, and it's these two muscles that my arrows are pointing to. Contraction of these muscles helps flex the thigh. So the origin here, you have to go with the psoas major, is the transverse processes and the bodies of the thoracic vertebrae and some of the lumbar vertebrae. So the psoas is the one closer to the vertebra here. The insertion is the lesser trochanter of the femur, and it inserts along with the iliacus. And then the origin of the other is going to be the iliac fossa, which you can see in this image as well. Moving down, we have the pectineus. This muscle is going to adduct the thigh. The origin is the pectineal line of the pubis. The insertion is the pectineal line of the femur. The abductor longus, this will adduct and flex the thigh. It is going to, the origin of that muscle is the pubis near the pubic symphysis, and the insertion is the linea aspera of the femur. The adductor brevis, which is kind of in behind the adductor longus. This is going to flex the thigh and adduct the thigh. The origin is the inferior ramus of the pubis, and it inserts on the upper third of the linea aspera of the femur. And then down here near the bottom, you have the adductor magnus. This adducts the thigh and flexes the thigh. And then the hamstring part of this will laterally rotate the thigh. The origin of this muscle is the ramus, the inferior ramus of the pubis, and the ischial tuberosity. The insertion for the hamstring part is going to be the linea aspera of the femur. For the adductor part, it's going to be on the adductor. It's going to be on the tubercle of the femur. The gracilis, shown here near the top again, is going to adduct the thigh and flex the thigh and leg. The origin is the inferior ramus and the body of the pubis. The insertion is the medial surface of the tibia, which you can see in this image. Moving on to muscles of the anterior compartment of the lower leg. These are generally responsible for dorsiflexion, while muscles of the posterior compartment of the leg are typically responsible for plantar flexion. And then the lateral and medial muscles in both compartments can invert, evert, and rotate the foot. All right, so let's start with the quadriceps femoris group. This is going to include the rectus femoris, which will extend the leg and flex the thigh. The origin of this muscle is the anterior inferior iliac spine. The insertion is going to be that quadriceps tendon that you can see here near the bottom. And then that takes you to the patella and the patellar ligament, which is also going to be attached to the tibia. Next is the vastus medialis. This extends the leg. The origin here is going to be on the femur, and then the insertion will be the quadriceps tendon, again to the patella, and then that patella ligament, which will take you to the tibial tuberosity. Next you have the vastus intermedius, which I've shown you here. This is below or deep to the rectus femoris, so I'm using a slightly different image for you to look at. It's the one that's kind of got the yellow and orange. The origin here is going to be the anterolateral surface of the femur. The insertion is going to be that quadriceps tendon again. Next we have, and lastly, we have the vastus lateralis. This is going to extend the leg when it contracts. This is the origin is going to be the greater trochanter of the femur, and the insertion will be the quadriceps tendon again. So all of these insert on that tendon that ultimately is associated with the patella and the tibial tuberosity. All right, moving on to the hamstring group, we have the the biceps femoris. This has a long head and a short head. It extends the thigh, flexes the leg, as well as laterally rotating the leg. The origin of the long head is the ischial tuberosity. The short head origin is the linea aspera of the femur, and then they're going to both insert on the head of the fibula. Also here is the semimembranous. This medially rotates the leg. The origin is the ischial tuberosity again, and the insertion is the posterior surface of the tibia on the medial condyle. Last here we have the semitendinosus. Contraction of this muscle will also extend the thigh, flex the leg, and medially rotate the leg. The origin is the ischial tuberosity, and the insertion is the proximal medial surface of the tibia. All right, so muscles on the anterior compartment of the lower leg are typically going to be generally responsible for dorsiflexion, and the posterior one of the lower leg are going to be responsible for plantar flexion. Both compartments can invert, evert, and rotate the foot as well, though. All right, so let's first start with the triceps surae or calf group of muscles. That's going to include the calcaneal or Achilles tendon, which is shown here. That's going to take us to the calcaneus bone. The gastrocnemius, this muscle is going to flex the leg, and it's also the agonist of plantar flexion of the foot. The origin here is the superior and posterior surfaces of both the lateral and medial condyles of the femur, and the insertion is the calcaneus, ultimately via that calcaneal tendon. You also have the soleus. This is going to be an agonist for plantar flexion of the foot. The origin is the proximal shaft of the fibula and the medial border of the tibia, and it inserts also on the calcaneus, again via that calcaneal tendon. So next we have some muscles that are going to move the ankle and foot, and this is in a deeper layer. So we're removing that tendon, that calcaneal tendon, and the gastrocnemius so you can see them. So first here's the tibialis posterior. This muscle will plantar flex the foot, and it's also an agonist of inversion or inverting the foot. The origin is the fibula, tibia, and the interosseous membrane between them, and the insertion is the metatarsals 2 through 4, and the navicular bone and the cuboid bone. The popliteus, this muscle will flex the leg, medially rotate the tibia to unlock the knee. The origin is going to be the lateral condyle of the femur, and the insertion is the posterior proximal surface of the tibia. The flexor hallucis longus, this contraction here is going to cause plantar flexion of the foot, and it also will flex the great toe or the big toe. The origin is the posterior lower 2/3 of the fibula, and the insertion is the distal phalanx of the big toe. And then we have the flexor digitorum longus. This is going to cause plantar flexion of the foot, as well as flexing the other toes. The origin is the posterior-medial surface of the tibia, and it inserts in the distal phalanges of toes 2 through 5. Now moving to muscles on the anterior side. Again, muscles that are going to move the ankle and foot. First we have the tibialis anterior. This dorsiflexes the foot, and it's an agonist for inverting the foot. The origin is the lateral condyle, as well as the shaft of the tibia and the interosseous membrane. It inserts on metatarsals 1 in the first cuneiform. The next is the fibularis longus. This everts the foot. It's an agonist for foot eversion, and it has a weak involvement in plantar flexion. The origin, the head and upper 2/3 of the shaft of the fibula, as well as the lateral condyle of the tibia. The insertion is at the base of your metatarsal 1. You also have the fibularis brevis. This is going to be an agonist, again, to everting the foot, and it's weakly, it contributes weakly to plantar flexion. This is going to have an origin at the shaft of the fibula, and the insertion will be the base of metatarsal 5. The extensor digitorum longus is shown here. This dorsiflexes the foot and extends toes 2 through 5. The origin is the lateral condyle of the tibia, as well as the anterior surface of the fibula and the interosseous membrane, but it inserts on those distal phalanges of toes 2 through 5. And then we have the extensor hallucis longus. This is going to dorsiflex the foot and extend the great toe, or the big toe as I call it, although I think great toe sounds funnier. The origin is going to be the anterior surface of the fibula, the interosseous membrane, and it's going to insert on the distal phalanx of that great toe, the number 1. And that is all for our, oh, sorry, before I end, this is just showing that same muscle. And you can see how that tendon ultimately takes it all the way down to that distal phalanx of the great toe or the big toe. And that is all the muscles for the lower limb. Thank you.